Well, another day, another Alberta Health Services CEO fired. The constant political interference, restructuring, changing titles, changing positions, firing boards, hiring executives, then firing executives, has turned the management of AHS into a farce, Mr. Speaker. You just can't trust this PC government with our public health care system. Since its creation 5.5 years ago, this government has been unable to provide stable governance for our health care system. To the Premier, why not?
Mr. Speaker, again, deja vu. I tell you, Mr. Speaker, we stand in this House and we listen to the opposition tell us that we need to make changes at the top of Alberta Health Services. We are doing that, Mr. Speaker. We are ensuring that as we move forward that we are continuing to put patients first, to ensure that frontline workers have the best possible circumstances to work in. We will continue to do that. We are committed to ensuring that that happens, Mr. Speaker, and I'm very pleased that this minister is in charge of that department to do it.
I hate to inform the Premier, when we asked for changes at the top, we meant her. Just 2 weeks ago, after the NDP raised the alarm about the privatization of lab services in the Edmonton region, then CEO Duncan Campbell announced they were pausing to consult with healthcare professionals. The decision was immediately countermanded by good old Mr. Interference, the Minister of Health. To the Minister of Health, will he admit that Duncan Campbell was turfed because he wanted to consult with doctors before privatizing a key piece of our healthcare system?
Minister.
Well, Mr. Speaker, as the honourable member knows, we are in an interim period between one permanent CEO and the next permanent CEO of Alberta Health Services. I trust Dr. Cal, the official administrator, to make the best use of all of the talent on the executive team to ensure that during the interim period we continue to be focused on the things that matter most to Albertans. Mr. Speaker, the honourable member is well aware of all of these facts. The honourable member is also aware that this government has asked Alberta Health Services to do a better job of consulting with employees and stakeholders and others prior to making major decisions. They're doing that, Mr. Speaker. They've been doing it for some time now. We're very pleased to see it, and we expect to see it.
Very much, Mr. Speaker. Well, this government's been in an interim period ever since Dr. Duckett learned that cookies were not on the menu. Back in February 2012, the Health Quality Council said, quote, massive reorganization at the system level and within Alberta Health Services has further blurred lines of authority and accountability. And they recommended that no further major restructuring in the system be done without a clear plan, rationale, and consultation. And yet this government has continued its compulsive meddling and habitual tinkering. Every day this government's incompetence saps the morale of frontline healthcare workers. When will its Premier admit that her government is simply incapable of running our healthcare system?
Mr. Speaker, diatribes like that are what undermine the confidence and morale of frontline healthcare workers. Mr. Speaker, the honourable member knows full well that we are operating through an interim period now. Mr. Speaker, these are management day-to-day decisions. I believe they are not of concern to my constituents. If the honourable member wants to believe that they're of concern to his, he's welcome to focus on that as he sees fit during question period. But, Mr. Speaker, make no mistake, the envy of Canada with respect to funding for health care and with respect to the opportunity of a single delivery system is this province. That just went up a whole lot more today, Mr. Speaker, with the proclamation of the Alberta Health Act.